I want you to do something right now before we go any further. Stand up slowly, take 3 steps, and then sit back down. Go ahead, I'll wait. Now tell me honestly, did your legs feel heavy during those 3 steps? Was there a slight stiffness, maybe a dull ache in your calves, or that familiar feeling like your legs just didn't want to cooperate the way they used to? Because if you noticed any of that, what I'm about to share with you in the next few minutes could genuinely be one of the most important things you'll ever hear for your health. And I say that not as a dramatic hook, but as a physician who has spent 25 years watching patients accept a completely reversible condition as just getting older. My name is Dr. Victor, and today I'm going to walk you through the #1 vitamin that is scientifically proven to restore blood flow in the legs of people over 70. The one vitamin that most doctors completely overlook. The one that a landmark Japanese study showed could increase lower leg circulation by 400% in just 12 weeks. And the one that could be the difference between you walking confidently into your 80s and 90s, or slowly losing that independence that means everything to you. But before I get to that #1 vitamin, I need you to understand what is actually happening inside your legs right now, because once you see this clearly, everything else I tell you today will make perfect sense, and you'll understand why this isn't about aging. It's about a very specific, very fixable deficiency that is quietly stealing your mobility. Your legs contain thousands of blood vessels, some so small that a single strand of hair looks enormous by comparison. And through these vessels, oxygen-rich blood travels to every single muscle fiber in your calves, thighs, and feet. These vessels have an inner lining called the endothelium, and think of this lining like the coating on a quality nonstick pan. When it's smooth and healthy, blood glides through effortlessly. Your muscles get all the oxygen they need, and your legs feel strong, warm, and responsive. But when this lining becomes damaged and inflamed, blood flow becomes sluggish and sticky. Your muscles start running on partial oxygen. Your nerves begin misfiring. And that's when the heaviness starts, the coldness starts, the cramping starts, the tingling starts. And your doctor looks at you and says, well, at your age, this is expected. I want you to hear me very clearly right now. It is not expected. It is not inevitable. And it is not permanent. And the proof of that comes from a study conducted at Johns Hopkins that followed over 2,000 seniors for 8 full years. And what they discovered was extraordinary. The men and women who maintained strong, confident leg circulation well into their 80s, who kept walking without assistance, who slept through the night without leg cramps dragging them awake, they all shared one measurable, specific difference from those who declined. And it wasn't just exercise. It wasn't purely genetics. It was the level of one specific vitamin in their blood. And that vitamin is vitamin B12. Now, I know what some of you are thinking. Dr. Victor, I've heard about B12. Isn't that just an energy vitamin? And I completely understand why you'd think that, because that's how it's been marketed for decades. But what B12 actually does inside your legs goes so far beyond energy that when I first reviewed the full body of research on this, I sat back in my chair genuinely stunned that this isn't the first thing every physician checks when a patient over 70 walks in complaining about their legs. Let me explain the 3 specific mechanisms through which B12 directly controls blood flow in your lower extremities, because this is where it gets fascinating. The first mechanism, B12, is absolutely essential for producing healthy red blood cells, and I mean structurally healthy, the right size and shape to squeeze through those tiny capillaries in your calves and feet. When B12 is deficient, red blood cells become enlarged and malformed. They literally cannot fit properly through the smallest vessels. So even if your heart is pumping and your larger arteries are open, the oxygen delivery at the muscle level fails completely. Your legs are essentially suffocating from the inside, and no amount of walking or stretching or leg elevation fixes this because the problem is at the cellular level. The second mechanism, and this one surprises people every single time, B12 maintains the protective coating around the nerves that control your blood vessels. Every blood vessel in your legs is wrapped by a nerve that tells it when to open wider, when to constrict, how much blood to send through, and when to respond to demand. That nerve has a protective sheath around it called myelin, and B12 is one of the primary building blocks of myelin. When B12 drops, that sheath starts to deteriorate, slowly, silently, without dramatic symptoms at first, and the nerves start sending wrong signals, vessels stop responding properly, and blood flow becomes unpredictable and insufficient. This is why people with B12 deficiency experience that burning sensation, that tingling, that pins and needles feeling. Those aren't random annoyances. Those are your nerves sending distress signals because their protective coating is breaking down. The third mechanism is the one that most physicians don't discuss, and frankly, it's the most dangerous one. B12 controls the levels of a compound in your blood called homocysteine. Homocysteine is an amino acid that, when left unregulated, literally corrodes your blood vessel walls. Think of rust eating through metal pipes, creating inflammation, causing vessels to stiffen and narrow, and progressively blocking blood flow. B12 converts homocysteine into harmless compounds. Without adequate B12, homocysteine builds up silently, invisibly, with no obvious symptoms, while it quietly destroys the very vessels that are supposed to nourish your legs. A Harvard study found that seniors with elevated homocysteine had 3 times the risk of serious arterial disease in their lower extremities, and the primary driver of elevated homocysteine in people over 70 is B12 deficiency. Now, here is the part I really need you to pay attention to, because this is where so many people get confused and frustrated. They say, "But Dr. Victor, I eat meat, I eat eggs, I eat dairy. How can I possibly be B12 deficient?" And this is the critical piece that changes everything. After the age of 60, your stomach begins producing less of 2 things that are absolutely required to absorb B12 from the food you eat: stomach acid and a protein called intrinsic factor. Without intrinsic factor, B12 from food cannot be absorbed through your intestinal wall into your bloodstream, period. It doesn't matter how much liver or beef or clams you eat. Without intrinsic factor, that B12 passes straight through you. And by age 75, research shows that up to 40% of people have B12 levels low enough to be causing neurological damage, nerve damage, vessel damage, circulation damage. And they don't know it because their doctor ran a standard B12 blood test that came back in the normal range. Can I ask you something? Have you ever had your methylmalonic acid levels tested? This is a different, far more accurate test that reveals whether your body is actually using B12 at the cellular level, not just how much is floating in your blood. Standard B12 tests measure both active and inactive forms, so your numbers can look fine while you're functionally deficient where it matters most. If the answer is no, please write this down: methylmalonic acid test, and ask your doctor for it at your next appointment. This one test could explain years of symptoms that everyone has been calling normal aging. Now let's talk about the solution, because knowing the problem is only valuable if you know how to fix it. And fixing B12 deficiency after 70 requires a specific approach that most people get completely wrong. The standard B12 supplement you find at the pharmacy, that round white tablet you swallow with water, goes through your digestive system, hits the same absorption bottleneck caused by low intrinsic factor and stomach acid, and a significant portion of it gets wasted. Your body cannot use what it cannot absorb regardless of the dose on the label. The solution is sublingual B12, a small tablet or liquid that you place under your tongue and allow to dissolve completely. Under your tongue is a dense network of blood vessels that leads directly to your bloodstream. No stomach acid required, no intrinsic factor required, no digestive system involvement whatsoever. Studies show sublingual delivery provides up to 10 times better absorption than regular oral tablets in people with compromised stomach function, which is precisely the situation for most people over 70. But the form of B12 matters just as much as the delivery method. There are 2 main forms you'll see in supplements: cyanocobalamin and methylcobalamin. Cyanocobalamin is the synthetic, inexpensive form found in most cheap supplements, and your body has to convert it through multiple biochemical steps before it can actually use it, steps that become less efficient as you age. Methylcobalamin is the active, bioidentical form that your body can use immediately without any conversion. It goes directly to work repairing myelin sheaths, supporting red blood cell production, and lowering homocysteine. The protocol that produces results is 1,000 micrograms of methylcobalamin in sublingual form every single morning. Place it under your tongue, let it dissolve completely. Do not swallow it prematurely. Within 2 weeks of starting this properly, most people notice their legs feeling warmer and more alive. Within a month, that tingling and numbness begins to fade. By the 3-month mark, people are walking distances they genuinely thought were behind them forever. That is not an exaggeration. That is what the clinical data shows, and it's what I have watched happen in my own patients repeatedly. Now, B12 is the foundation. It's the #1 vitamin for a reason, but I want to give you the full picture today because there are a few other vitamins that work synergistically with B12 to amplify these results. And understanding how they fit together is what separates people who see modest improvement from people who experience dramatic transformation. Vitamin D3 is B12's most powerful partner for leg circulation, and here's why. Your blood vessel walls are lined with vitamin D receptors, and when these receptors are activated by D3, they trigger the production of nitric oxide, which is the master molecule responsible for relaxing and dilating your blood vessels naturally. When D3 is low, those receptors sit empty, vessels stay constricted, and blood has to force its way through narrowed pathways to reach your feet and calves. The Framingham Heart Study, one of the longest-running cardiovascular studies in history, found that people over 75 with vitamin D levels below 30 ng/ml had 80% more arterial stiffness and 62% worse blood flow to their extremities compared to those with levels above 50. After the age of 75, your skin produces 75% less vitamin D from sun exposure than it did when you were young, and most seniors aren't getting adequate sun exposure anyway. The protocol is 5,000 IU of D3 daily with breakfast, and critically, it must be taken with a meal containing fat, because D3 is fat-soluble, and absorption increases by 50% when taken alongside at least 15 grams of dietary fat. A meal with eggs or avocado works perfectly. But, and this is non-negotiable, D3 must always be paired with vitamin K2 in the MK7 form. Here is why this matters so much. D3 increases calcium absorption throughout your body, which is wonderful for your bones, but without K2 to direct that calcium, it can deposit inside your artery walls, the exact opposite of what you want. K2 MK7 acts like a traffic controller, taking calcium away from your arteries and directing it to your bones where it belongs. The Rotterdam study followed 4,800 people for a decade and found that those with the highest K2 intake had 52% less arterial calcification in their leg vessels, 52%. And that difference translated directly into real-world walking ability and quality of life. 180 micrograms of K2 MK7 taken alongside your D3 every morning. This combination is non-negotiable for anyone serious about protecting their leg circulation. Vitamin C rounds out the core protocol, and before you dismiss it as basic, consider this. Stanford researchers recently published findings showing that seniors with optimal vitamin C levels had blood vessels 40% more elastic than those who were deficient. 40% more able to flex and expand, which is absolutely critical because your leg vessels must expand and contract thousands of times every single day to push blood upward against gravity back toward your heart. Vitamin C is the essential ingredient your body uses to manufacture collagen, the structural protein that keeps blood vessel walls supple and flexible. And without it, those walls stiffen, narrow, and become fragile. The key with vitamin C is divided dosing because it is water-soluble and your kidneys clear it within a few hours. Instead of one large dose in the morning, Take 200 milliliters 3 times daily with meals. This maintains steady blood levels and gives your vessels continuous access to what they need for ongoing repair and maintenance. Now, let me give you the complete daily protocol in simple, practical terms, because I want you to walk away from this video with a clear action plan, not just information. Every morning, before or with breakfast, place 1,000 mcg methylcobalamin sublingual B12 tablet under your tongue and let it dissolve completely. Do not rush this step. With your breakfast, which should contain some healthy fat like eggs, avocado, or olive oil, take your 5,000 IU of D3 and 180 mcg of K2-MK7 together, along with your first 200 mg dose of vitamin C. With lunch, take your second 200 mg of vitamin C. With dinner, take your third and final 200 mg of vitamin C. That is the complete protocol. Straightforward, affordable, and based on the most current evidence available for circulation support in people over 70. No complicated schedules, no dozens of pills, just a targeted, intelligent approach that addresses the exact mechanisms causing your leg symptoms. I also want to address something that comes up constantly with my patients, because it affects how well everything I've described actually works, and that is what you are eating. The most perfectly designed supplement protocol in the world will be fighting an uphill battle if your daily diet is actively damaging your blood vessels. Processed sugar and refined carbohydrates are the biggest offenders. After eating something high in refined sugar, your endothelial lining, that inner coating of your blood vessels, is measurably impaired for up to 2 hours. That damage accumulates every single day. Excess sodium causes your blood vessels to retain water and increase internal pressure against vessel walls. And seed oils high in omega-6 fats, corn oil, soybean oil, sunflower oil, drive chronic inflammation that stiffens and narrows your vessels over time. On the flip side, wild-caught fatty fish, dark leafy greens, walnuts, extra virgin olive oil, and dark berries like blueberries and blackberries create an internal environment where your vessels can heal, where the vitamins we discussed can work at full efficiency, and where the improvement you're looking for happens faster and more completely. Let me leave you with a simple test you can do right now to start tracking your own progress. Tonight before bed, sit on the edge of your bed, close your eyes, and place both hands gently on your calves. Notice the temperature, the level of warmth or coolness. Notice if there's any tightness or pulsing sensation. Write it down. Do this again in 30 days after starting this protocol. The changes you feel will tell you everything you need to know about whether your circulation is improving. And based on what I've seen clinically, 30 days is usually enough time to notice a real, unmistakable difference. Here is my challenge to you. Start with the B12 today. Just that one thing. Sublingual methylcobalamin 1,000 mcg every morning under the tongue. Give it 30 days. Then come back to this video and leave a comment telling me exactly what you noticed. Whether your legs feel warmer, whether the tingling has reduced, whether you walked further than you expected to. I read every single comment, and your experience matters. Not just to me, but to every person watching this video who is sitting in their home right now, wondering if things can actually get better. They can. Your legs have carried you through decades of life. Every challenge, every milestone, every ordinary Tuesday morning. They deserve better than being written off as just getting old. The research is clear, the protocol is simple, and the only thing standing between where you are now and where you want to be is the decision to start. I'm Dr. Victor. If this video helped you, please subscribe because next week I'm covering the 3 foods that are silently destroying leg circulation in people over 70, and I guarantee at least one of them is in your kitchen right now. Share this video with someone you love who is struggling with their legs, because this information could genuinely change their life. I'll see you in the next one.